All right, so good morning, good afternoon to everyone that's joining the call. Thank you very much for joining us today. And welcome to the Global PrEP Learning Network, where our focus will be on supporting clients' PrEP decision-making across multiple products. And as we know, we are moving towards a multi-product HIV prevention market where the adolescent girls and young women must be empowered to be able to choose a HIV prevention product that meets their needs. So in this webinar today, we will provide an update on the current market status of oral PrEP, the PrEP ring, and also the injectable PrEP, and be able to explore what choice means in the context of HIV prevention. So we will also be able to talk about some exciting new tools that have been designed to support clients in making their decision about PrEP use, and also hear directly from some very energetic, informed youth advocates. They're going to share with us more about what they need to be able to make informed choice in HIV prevention. So once again, welcome, and let's keep introducing ourselves in the chat. Sorry, if you can just go back to the information that people can provide on the chat. Please put in your name and the name of the organization and country. So thank you very much. We can proceed. So I would like to take this opportunity to just begin by welcoming our key speakers today, panelists and experts in the room, who are going to share with us important information and ideas and some thoughts on what really is choice. So I want to introduce our key panelists for today. We have Dr. Elizabeth Irungu, who is a regional technical advisor at AGYW. And she's also, she's previously worked as a country director for Partner Scale-Up projects. For a number of us in Kenya, we may be familiar with that. And she sits at the PrEP Technical Working Group that is chaired by the National AIDS and STI Control Program in Kenya. Next is Danielle Chaville, who is a research clinician at Vitsarichai in South Africa. Her work focuses mainly on sexual and reproductive health and sexually transmitted infections, with a passion for primary healthcare, combining her clinical background with her experience in research, and her work focuses on implementing evidence-based research in real-world settings. Elmarie Bradenham is a technical lead in program engagement implementation science at Vitsarichai, South Africa. She's PrEP passionate and driven by a desire to meaningfully engage young people and the communities that they serve. Elmarie is, So Elmarie is classically trained as a graphic designer with degrees in communication science and also gender studies, and is responsible for ensuring quality and evidence-informed approaches to demand creation. Next. We have Definite Namo. Definite is a senior program manager at Pangaea Zimbabwe AIDS Trust, and she has spent over 2 decades working on increasing access to sexual and reproductive health services and facilitating HIV/AIDS care and treatment to female adolescents in Zimbabwe in both research and program delivery settings. She is a member of the HPTN Scientific Committee. Then we have our youth advocates. We have Sally Kabule. She's from Vitsarichai, MOSAIC Community Liaison Officer. And she's a HIV prevention ambassador who is very passionate about adolescent girls and young women empowerment. She's dedicated to helping her peers make informed decisions about biomedical prevention products. We have Havana Mtetwa, who is a youth representative from PZAT in Zimbabwe. She's an avid reader and a garden lover. She strives to be as involved as possible in projects that she does, and she plans to leave the world a better place than she met it. Next, we have Nibeshaho Marie Mexi, who is a youth representative from LVCT Health in Kenya, and she is a young advocate who has also been the president of the Nairobi Youth Advisory Council, a former member of the Tausi Task Force under her Voice Fund, and was also an Empower for Change champion under LVCT Health. She's an advocate for sexual reproductive health for adolescents and young people. We have Louis Katoka. She's a program assistant at Zimbabwe FHI 360, also as the youth representative. And she has had an opportunity to work as an intern under the Promise project. She's passionate about SRHR and choices that young women can make with regards to their health. So thank you very much. At this juncture, I want to call upon Dr. Elizabeth Irungu to take us through her presentation. Over to you, Elizabeth.
Thank you. Thank you very much, Patricia, for setting the stage for all of us. So as I start, I think it's important for all of us to understand that people's lives and relationships are dynamic, and that what works for one may not work for another. And also what works for someone today may not be the best fit for them tomorrow or the day after. So choices are necessary so that people can choose a product that fits their needs. In family planning, we've observed that the availability of more methods and more products leads to wider uptake, as people who cannot or will not use one product effectively can choose another. So this is also likely to be true for HIV prevention, and we anticipate that more products will help normalize HIV prevention. So next slide. So let's review available or near available PrEP products. Next slide. We know oral PrEP, the daily oral pill. It has greater than 90% effectiveness when taken as prescribed, with advantages that it is easy to cycle on and off. When you don't want to use it, you can stop. When you want, you can restart. And we also know that many countries have some form of PrEP program, seen as the yellow countries on this global map from PrEP Watch. What we have observed is that most of PrEP is delivered in HIV programming sites. And while this has some advantages, it also presents challenges that with access for some populations and also stigma arising from being found or being associated with HIV programming. So with the lessons learned so far, I think there are opportunities to consider PrEP delivery in other avenues within health facilities and community settings for oral PrEP. There are some limitations for oral PrEP, including the required daily use, pill burden and pill fatigue, and some people experience side effects with use. And so oral PrEP also may not be as discreet as desired by some users. Next slide. The dapivirine vaginal ring, or the PrEP ring, has been shown to reduce risk of HIV by 35% in clinical trials and up to 50% in open label studies. The ring is to be worn inside the vagina and replaced monthly, thus addressing the challenge of a product that needs to be administered daily. And we also know that one can easily cycle on and off it because you can put it in and get it out, as it is user controlled and has potential for being discreet, as once it's in there, nobody needs to know that you have it or you're using it. So the World Health Organization has recommended that PrEP ring be offered as an additional prevention choice for women likely to acquire HIV. And the ring has received regulatory approval in several countries. It presents an opportunity, I think, to explore PrEP delivery in other settings, especially in the sexual and reproductive health spaces, and also in the community. However, while we are so used to using a pill and swallowing a tablet every day, I think there's much less familiarity with vaginally inserted products. There are also concerns regarding its efficacy and currently not available in programs. Next slide. Injectable PrEP with cabotegravir has generated lots of excitement, and rightly so, I think. It has high effectiveness compared to oral PrEP. It can be discreet because once you get in your shot, every 2 months, nobody knows where you have been. And people have been comfortable with injections, as we have seen women use DMPA for family planning. So we do have regulatory approval for the ring in the US. Review is underway in several countries, and we anticipate WHO guidance or recommendations mid this year in a month or so. There are a few limitations with cabotegravir injection, especially including the stringent HIV testing requirements that came with FDA guidance. And the aim of this testing requirements was to address the concerns of delayed HIV detection and potential development of resistance should CAB-LA be administered to people with undetected HIV infection. I think the other limitation is that with the current recommendation for 2 monthly dosing, then it may be difficult to align with the quarterly family planning visits that we are used to. But there is generally a lot of excitement with the injectable PrEP. So these are the methods that are available or nearly available. And so here I want to share a few thoughts about how we can support adolescent girls and young women make informed PrEP choices. We know first that young women, and generally everybody else, likes to have choice, and choice for HIV prevention, I think, is important. So in the TRIO study that you may be aware of, women aged 18 to 30 years were enrolled and were given placebo delivery forms of either the tablet, the ring, or the injection. And in that study, participants were asked to rank products in order of preference. So as you can see here, while injections were most highly ranked, there were young women for whom tablets, rings, or condoms was the most preferred HIV prevention. And so it wouldn't be right to say that there's only one product that fits everybody. Next slide. And so to help young women make informed choices, I think there needs to be readily available, easy to read and understandable materials that adolescent girls and young women can use to help make the choice. For instance, this tool from the HIV Prevention Ambassador Training Package would help a young woman think about vulnerability to HIV. Would think about her seasons of risk, her partner issues, her personal commitment to HIV prevention, and also personal preference and the other factors that are listed on this tool. And so I'd imagine that a young woman could go through this tool with her provider and be able to understand what are the factors that are going to influence her make whichever PrEP choice she's going to use, or even have this document and go home with it where she can continue thinking about things she might have discussed with her provider and things that she needs to consider as she makes PrEP choices. Next slide. I think this is a PrEP decision tool. This has been developed by Jen N. And I think this is a tool that would be adapted to help a young woman choose whatever method she wants to use and use effectively. So as you can see here, it will help her make a plan and hopefully follow through with a plan throughout her PrEP journey, depending on the PrEP choice she uses. So she would make decisions about, clarify to herself, why am I taking PrEP? What's likely to get in the way? What's likely to help me continue to use PrEP? And mark on a calendar or something about, to remind her that she has taken her pill or used her ring or her injection as required. Next slide. So I think at the user level, at the level of the girl, there are several interventions and approaches that have been tested to help young women stay on HIV prevention, and all with varying levels of success. For instance, young women on various methods can be enrolled in adherence clubs or support groups where they can share their experiences using various PrEP methods. They can encourage each other. They can motivate one another to continue using various PrEP methods as are available. and during the periods of likelihood for HIV exposure. But also, there's been a lot of excitement with mobile health and telehealth, especially during these COVID times. And I think mobile health or mHealth approaches can be used for private ad hoc consultations with various PrEP products. So a girl would go on a ring and she would have a problem in her home, and she can, reach out to a health provider via WhatsApp or whatever other mHealth tool she has and say, hey, please help me, I'm experiencing this, how do we address? Or should I change and start using a different method, And she doesn't have to necessarily come to the facility for that kind of consultation. I think you could also use the phone to send reminders about visits and generally to obtain information about PrEP in general. And then to support effective use, PrEP refills and visit schedules, I think, should be tailor-made to address the dynamic changes in routines of young women and their HIV prevention needs. So while it's easy to say that, come for your refill quarterly, I think there were some studies that showed, if once you made that time longer, then girls seemed to falter. And if it's so close, they did well. But then for other populations, the reverse is also true. So just understanding the need of the young girl for each method she uses and have schedules that are flexible for her to come in and interact with the providers she needs. Next slide. I think the other thing is that health providers would be instrumental in supporting how women make choices about the PrEP product that best suits them. So there's a need to ensure that providers are trained and understand the various PrEP products, because when providers do not understand a product, they will not offer it. They will not prescribe it. They will not dispense it. And also importantly, I think providers should be comfortable offering choice to young women and be comfortable with, things like discontinuation and restarts and switching between methods. And while this is new for the PrEP field, I think there's a lot we can learn from the family planning space. Providers will be supporting PrEP choice when they are empathetic and when they would say to a girl seeking services that, I appreciate you, I am listening, I will help you make the right choice, and I believe in you, your secrets are safe with me, so that the girl is comfortable coming into that space and talking to the provider and saying, this is my challenge. And the provider would say, here are all the options I have for you, and I will help you make the right choice for your prevention needs. So next slide. Then at policy level, I think policies that normalize PrEP and ensure availability and accessibility of PrEP products will go a long way in supporting choice for young women. And I think policies would do this if they allow delivery of PrEP services in non-traditional venues, such as in communities and using telehealth, in places where you will find the young women and places where young women are comfortable going to. But also that the policies should be able to make PrEP service delivery simple and inexpensive for the user. So for instance, let's have few labs, let's have shorter waiting times, or have a same day start, have one-stop shop approaches to delivery. And in this way, I think try and make PrEP delivery and the whole PrEP program a fun experience for the young people, because I think that's what they're looking for. What we are all looking for is some fun as we carry on with our daily lives. Next slide. And then the last bit is regarding the community and remembering that young women live within a community, and the community needs to understand PrEP and understand PrEP choice. And that young women may be at risk of HIV exposure, but they can also make choices to protect themselves. So when the community has this understanding, then we are able to enlist partners and peers and the people around communities to come in and support the young women as they are choosing their PrEP and continue supporting them as they are using their PrEP, whichever method that they choose to use. Next slide. So the family planning field has gone before us in this realm of providing choice. And I think there's lots we can learn from them, including how to offer counseling, including how to tell users how to work with potential users to figure out what method is best for them. The next slide. And the materials that are there for providers, which I think we can borrow or tailor make for PrEP, that will, you have a quick and easy comparison of all the different methods available, what are the key messages, and what are the instructions that you give for each method. So I don't think we would be starting from a 0 point, but we'll really be able to move forward what's already there and pick what's worked for family planning and apply it for our HIV prevention work. The next slide. In summary, so I think we truly are excited that we now have several products, and it's not just the pill that we can choose from. And while each method has its strengths and weaknesses, I think individuals should be offered full information and given the opportunity to weigh for themselves what's good for them based on their unique needs and situation. And the best product is the one that a young woman will use effectively during periods of possible exposure to HIV. And so all of us, I think we really should endeavor to provide choice and support adolescent girls and young women understand, choose, and effectively use the method that works for them. So thank you very much. And I acknowledge many people who have helped develop these slides and come up with this content.
Right, thank you very much, Elizabeth. I encourage us to continue writing our questions in the chat. We will transition and move on to the next presentation from Elmarie. Elmarie, welcome and take us through the journey tool.
Thank you so much, Patricia, and thanks for making us all feel so welcome. Next slide, please. I have an opportunity today to present to you an idea that started a while ago, and this is both a client and a provider-facing tool to support the uptake of methods to achieve combination HIV prevention. And we refer to this as the HIV prevention user journey tool. Next slide. So as implementers, as program, as researchers, as young people, we all have an opportunity and also a responsibility. So as has been said, the method mix to achieve combination HIV prevention has expanded significantly over time. And the introduction pipeline of new methods for the future is really exciting. There's a lot going on. And hopefully in the future, we're going to have a lot of choice. Now, we need to ensure that clients are aware of their choices and informed to make choices that are relevant to their needs and their lifestyles. So in a nutshell, we have an opportunity and a responsibility to provide clients with information on the available and even near future methods and support clients in their journey to select their most appropriate combination of HIV prevention methods. Informed choice. Next slide. What we have come up with, as I said, this is an idea that has been in working for a long time, and we've really thought about how do we do this. And this is what we call the HIV prevention user journey tool. Now you'll note on your screen that there's one tool, but it's applied to two formats in order to reach as many as possible. We have a digital web form, which has been developed for mobile phone usage. And then we also have a printed paper-based tool. Now, the paper-based tool is probably best suited to healthcare providers. Now, this is a flip chart booklet that can stand on a desk, and it offers messages both for the provider, but also for the client. The digital tool, on the other hand, can be used by anybody, but is best suited to the client. Both tools have exactly the same information. In the digital tool, the information is just a little bit more hidden and only appears based on the selection of the person or the user in the tool. Primary audiences, women, all women, AGYW, older women, all women, but also healthcare providers. Then we also recognize that women do not exist in a vacuum. They have men as partners, men as peers, and they live in beautiful communities. And so our secondary audiences are these. Next slide, please. So if we look at both the printed tool as well as the digital tool, we wanted to make sure that prevention methods align to the needs of the client's preferences, and the client's lifestyle. So the journey starts with what is important to the client and not with an overload of HIV prevention information. And so for us, it was really important to put the client first. What is their needs and what will be suitable in their context of their lifestyle? And so the methods that is suggested to a client for combination HIV prevention is based on the client's selection of certain lifestyle statements that they feel appeal most to their situation, their life, their preferences. Now, of course, there is more information on all the different methods, but lifestyle questions, these are the ones that you can see on your screen. For instance, some clients might feel that they want the method or methods that work best, no matter what it takes. They just want to be 100% sure that they have the best prevention method, no matter what. Other clients might say that I want something that is discreet, that nobody else is going to know about. Or I want something that I can use while I'm pregnant or breastfeeding. Or perhaps I want something that does not contain medication. Or I want something that's not going to require my bloods to be drawn except for an HIV test. These are questions that clients can look at and feel which ones are most relevant to their life. And so these questions are both in the printed version and in the digital version. Next slide, please. So if we look at the journey on paper, there's a provider-facing section, but there's also, on the flip side, there's a client-facing section. And so the provider-facing section has all of the information, the facts, all of it that is about that specific method. So what is it? How does it work? How is it used? How well does it work? What are the side effects? What are the things I need to consider if I wanted to take this method, or that I need to remind my client of if they're choosing this method? These are the consideration. What are the most frequently asked questions? But it also has a client-facing side, and this has key messages for the client. So not so much text heavy, not so information dense. These are the key messages that we want clients to remember. What also happens in the journey on paper is you'll see there's a lifestyle statement at the top there, and it says, I want something that prevents both HIV and other STIs. Now, if a healthcare provider speaks to a client and a client says, this statement is really important to me, this applies to my life, I need something that prevents both HIV and other STIs. I'm sorted for family planning or contraception, but I'm worried about HIV and other STIs. Then we look at, okay, what are the methods that is a definite yes, that prevents both of these things? What are the methods that are, and those are the ones in the orange, that are a maybe or dependent on other factors? And then what are the methods that don't prevent both of these things? I hope that makes sense, but we'll go into this a little bit more. Next slide, please. So just another look at the journey on paper. It, of course, starts with the section that helps healthcare providers understand how to use this tool, how to start a conversation with a client, quick and helpful counseling tips, and then it jumps into these lifestyle statements. Now, there's 13 lifestyle questions, and each of them have 9 HIV prevention methods organized into 3 categories. So the lifestyle statement that we're seeing on our screen now is, I want something that prevents HIV if I have anal sex. So now we're looking at, all right, what's going to prevent? What is a definite yes? And so we see we have condoms and oral PrEP on the screen. What is a maybe or dependent on other factors? And what is a no or not applicable? In this case, for instance, abstinence is not applicable, and the ring will not prevent HIV infection if you're having anal sex. Next slide, please. Then we have the virtual journey. This is the journey of the journey tool on the internet, on the web. Now, what you're seeing in front of your screen right now, that is a very simple diagram of the back-end coding that we've done for this journey tool. And this is really client-focused, and it can be marketed through social media, through websites, through links, through QR codes, anyhow you like, and it can be accessed on a person's phone. Now, I could tell you about all of these different steps and how we coded it and the skip logic and the algorithms, that kind of thing, but it's probably best if we had a look at this. So, Casey, if you'd like to take us to the journey tool. So, like I said, you can access this on a website, but it has specifically been designed and optimized for a mobile phone screen. So right now, Casey, I know you won't mind being my client here. So if you're HIV negative and having sex, would you like to start exploring the HIV prevention methods? Casey is very eager. She says yes. Now, Casey, I'd like you to have a look at these questions and either agree or disagree with each of them. Thanks, that's fantastic. So as we can see, Casey selected or agreed with 3 of the questions. Now, how those questions work is if you answer yes to even just one of them, it takes you to the lifestyle questions. Casey, if you can just scroll up a bit for me. So what we have in the front here, and this is just a draft. We haven't actually published this yet, but now we see, all right, we've answered these questions. We probably need some HIV prevention methods. We're going to choose the 2 statements that best represent your life and needs right now, Casey. So, Casey, I'd like you to look at these statements and select what you think is going to work best for you. So, Casey has said, I want the method that best prevents HIV if I use it well, and I want something that I don't have to remember each time I have sex. Give me my methods, Casey. So, again, these are the 2 statements that Casey has selected, and we see immediately the yes category pops up here. And it says, PrEP methods like oral PrEP are meant to be used continuously while a person is vulnerable to HIV. So they do not need to remember these methods in the heat of the moment, because remember, Casey said she doesn't want to think about it all the time. And also oral PrEP is highly effective at preventing HIV through any type of exposure. Now, Casey, if you scroll down a little bit, we can try again. We could potentially go to find a service. We can go back to home. We could look at all the methods, which gives all of the different text, or we can, exactly, that's where we can click. We can look at more information. If I wanted to know a little bit more about STI management, I click for more information. I get more information. And then, Casey, if you can go back to the menu button, the hamburger menu button at the top. There we go. And then if I can ask you to just click on lifestyle statements. So here we have all of the lifestyle statements. And so, Casey, right now, I just want you to select the one lifestyle statement that you want to explore a little bit more. Right, give me my methods. So if we go up a little bit, let's see what falls into the yes category. So remember, we only selected one lifestyle statement, and that said, I want something that does not contain medication. And so then in the yes category, here we see some options. We see condoms. We see potentially, if you wanted to, you could look at fewer sex partners. If abstinence is your thing, you could consider that. But also treatment for a HIV positive partner. Maybe dependent on other factors is VMMC may require a person to take a certain antibiotics to prevent bacterial infection before or after the surgical procedure, but thereafter you're not really required to take any other medications. They're no or not applicable. So if we look at PrEP methods such as PrEP ring, oral PrEP, and PEP, they all contain medication. Regular STI testing and treatment as needed may require medication if a person is diagnosed with an STI. And in a nutshell, that's our journey tool. So Casey, if we can go back to the presentation, I'm aware I'm probably a little over time. Fantastic. So I just wanted to end off with a slide with a couple of notes to say the digital tool has been developed in such a manner that it can easily be adapted across countries. And so the digital coding, the way we've done it, is so that any country could easily plug it into an existing website if they wanted to do that. We also have a CMS, so a content management system, which is in progress, and this will be finalized when engagement with other countries have started and also concluded, because we want to make sure that this content management system is really on point for everybody that uses it. The paper-based tool is color-coded to ensure ease of navigation, but also so that countries can take out certain methods if they don't want it in there. So within the paper-based tool, like I said, methods not available in a specific country can be removed. The digital metrics that we're doing for the journey will report on user demographics, number of users who start the tool versus how many finish the tool, and so more. The digital tool will link to the PrEP Clinic Finder and hopefully also the BY Service Finder in South Africa. We want to make sure that there's actual linkage to care. Now, I have to say that this tool has not been finalized. We did pilot it with young people. They did give us some incredible feedback that was incorporated, but we do believe in this tool. We've put our hearts and our souls into this. It's the journey tool. We don't want to stop believing in it. That's my joke I always make about it. And so we really want to ensure that it is used and it is the most user-friendly tool for everybody. And so we're currently working on an optimization approach. And this is just to ensure that healthcare providers find it as easy as possible and as helpful as possible. And then all women, men as partners and peers really feel that the digital tool works for them, is easy to navigate and speaks to them. So on the next slide, I just want to say a big thank you, first of all, to Casey for being the driver of these slides and going through the tool, the digital journey, and doing such a great job. Thank you so much. And then, of course, to all of the partners who support and work on this, to MOSAIC for continued support in this. And then I have to give a big shout out to all of the young people that help us with this, but specifically my youngsters in South Africa. They are definitely the bomb and I love them. Thank you.
Thank you very much, Elmarie. Very exciting tool. I can read a lot of excitement in the chat. And thank you all for the ones who are asking questions on whether the tool can be shared. I think Elmarie has already said we are still developing it, and as soon as it is available, we will be able to put it out there and let everybody know that they can be able to use the tool. So I want us to transition to another presentation by Danielle. Danielle, over to you.
Thank you so much.
If we can save a few minutes.
Yes, I'm gonna try. I think, thank you so much for having me here today, and to Elmarie and Elizabeth for such fantastic presentations. I'm gonna try and not repeat as much as possible, so to make this go nice and quick. You can go on to the next slide. So I think Elizabeth gave us a really good kind of overview of why decision support tools and giving people the ability to choose is incredibly important when it comes to HIV prevention. And this is becoming more and more important as we have more options becoming available and getting approved in each country. I think we want to make sure that end users have the ability to make informed choices that are aligned to their own values and their own preferences, and that they're able to kind of adequately perceive their own risk and improve their knowledge when it comes to different HIV prevention methods. A PrEP decision support tool can overcome lots of client and provider barriers, particularly in resource constraints environments where there's a lack of time, there may be a lack of training, and there's also power dynamics or disparities between providers and clients that may result in kind of not ideal decision-making processes. And decision support tools have been shown to be particularly beneficial in busy clinical environments, so to kind of reduce the load on the clinical team, but also when new services are being integrated. For example, the integration of PrEP into primary healthcare clinics. You can go to the next slide. So in 2018, we developed the MyPrEP, a decision support tool, as part of the USAID-funded POWER project that was designed at presenting a focus on adolescent girls and young women, presenting them with different HIV prevention methods that were available, and then kind of helping them make a decision about which method may be preferable for them, with a focus on providing more information on oral pre-exposure prophylaxis, which at that stage was still incredibly new. The tool was designed as a way to kind of do a risk assessment for young women so that they could identify whether they were at risk with using non-judgmental language, and then kind of provided different options like condom usage, decreasing sexual partners, partners' HIV status, and then post-exposure prophylaxis, as well as oral pre-exposure prophylaxis. You can go on to the next slide. And this development process was based on partners that we worked with in the US, particularly UCSF, who had designed a patient-facing digital support tool called My Birth Control. And this was a contraceptive decision support tool that was used in the waiting room at clinics that provided contraception, so that young women could go through this decision support tool that would provide them all the information they wanted to know about the different methods that were available, and then allowed them to find the method that was most suited to them through what they called the method chooser. They did a randomized or a cluster randomized trial of about 760 participants and 30 providers in the US, and they found that the use of this tool really positively impacted contraceptive counseling and informed decision making and knowledge. Both providers and clients found this tool incredibly useful with regards to making a decision and identifying their own preferences. And both providers and clients found that a counseling session after the use of the tool was a lot more beneficial than just an information session provided by counselors. So we used a similar process here. We designed this tool, and then we went through multiple processes of an iterative development process with end users in both Kenya and South Africa to kind of get input on the images, on the language used, on kind of the tone of the tool to make sure that it was appropriate. You can go on to the next slide. And then we decided we want to evaluate this tool. We want to see whether this tool is just an information provider or whether this actually improves the way that people engage with PrEP use. And so we did an evaluation in Johannesburg, kind of evaluating as a primary outcome whether this tool had any impact on PrEP uptake, and then importantly, whether it had any input on PrEP continuation. We randomized women by day in a clinic to either look at the decision support tool or to look at just another health website. It was a nutrition website. And then we assessed PrEP uptake as well as PrEP continuation. We also did interviews, sorry. I was about to say informed consent. We did do informed consent, but we also did interviews with women to find and providers to find out how they found the tool impacted their experience. And this ran in 2019 and the beginning of 2020. The rest of the kind of PrEP visit was the standard Department of Health kind of PrEP visit, where you would get basic HIV counseling and PrEP counseling. You would see a clinician, and the rest of the visit would mimic what a real life provision of PrEP in South Africa looked like otherwise. You can go to the next slide. I'm not going to go into this, but this was just to kind of say that we found a high-risk population, a high risk for HIV population. They scored really high on the modified voice risk score. We had high prevalences and incidences of STIs. It was generally a high-risk population. You can go on to the next slide. So our primary objective, like I said, was PrEP uptake, and PrEP uptake was just high across both groups. There was kind of over 90% in both the decision support tool and the other website, 97 in the decision support tool, 94 in the other website. There was no real difference between these two groups. So the decision support tool did not seem to impact uptake of PrEP, but uptake of PrEP was incredibly high. You can click again, thanks, and again. So the secondary analysis looking at PrEP continuation at 1 month and kind of in the bigger project, we found that kind of 1 month was a proxy for continuation, that most people who we saw at 1 month and continued with PrEP kind of continued with PrEP appropriately thereafter. And we did see a twofold difference in PrEP continuation, with there being a much higher, twofold higher retention in PrEP care on PrEP continuation. And those that saw the decision support tool as opposed to those that had seen the other website. And so this intervention seemed to, although not impact uptake, it seems like very little kind of needed to be done for uptake, that uptake was really high, irrespective of seeing the tool, but that having seen the decision support tool and worked through it to decide to take PrEP, that retention was twofold higher than those that had not. You can go on to the next slide. And then importantly, the interviews kind of confirmed this. Users really liked using the tool. They found that it broadened their understanding of PrEP, and they found that it was really personally relevant to them. They found that they could relate to the scenarios on the decision support tool, and it said that they provided them answers to questions that they didn't really even know that they had before they came. They liked how it showed how PrEP works, oral PrEP works in the body, and explained the side effects. They found the language simple and the format easy to follow. And it prompted them to think about their other sexual and reproductive health needs more broadly. They found the content to be memorable, and that they did feel that the decision support tool had influenced their decision kind of to take PrEP. Very interesting. What came up a lot in the interviews was that what they found particularly helpful about it is that it confirmed information that they had heard somewhere else. And so this really was a triangulation of information, that they had seen information about PrEP elsewhere, and then this kind of just re-emphasized it, and they found that this was a reliable source for them. So you can go to the next slide. So we have updated this decision support tool because this was done in 2019, before the Defibrillator ring or CAB-LA was really available. And so we've added modules now on both of those. And we did cognitive testing in adults and youth, as well as people that were PrEP users of both the ring and oral pills. And that updated version should be available soon. So this is just kind of, I think you can just click through this relatively quickly, but this just kind of gives you an idea of what the tool looks like. You can click on the next slide. You can see there that the options become, oh, sorry, you go back one. The options become available. You can decide what you want to look at. You don't have to read all the information. You can click on what you're interested in, what you're not, and we'll just give you a bit more information. You can click onto the next slide. Then it speaks about specifically about PrEP. So there's information on the previous slides about condoms and partners and all of that. But then this goes into detail on oral PrEP, injectable PrEP, as well as the vaginal ring. You can click onto the next slide. You can see, yeah. So this just gives you a bit of the differences between PrEP and PEP. And then we added a section at the end because one thing that came up a lot was about family planning. A lot of people that were there for PrEP were also interested in family planning. And so we just added a small section in on family planning so that people could choose methods that may be interesting to them. You can click onto the next slide. So yeah, just a big thank you to everyone that kind of contributed to this, particularly to Sinead Delaney Molefe, who helped with the slide, and the research team that kind of worked across projects, both the Power project as well as the Decision Support Tool study. Thank you very much.
Thank you very much, Danielle. Really a lot of interesting findings that you have been able to share with us. And I see a lot of engagement in the chat, people wanting to know when the tool will be ready for rollouts. And Elmarie, you're doing a good work just responding to those in the chat. So I want to now welcome a very exciting team of panelists, young people who are here with us. And so we have Sally, who is from South Africa, Mercy from Kenya, Havana from Zimbabwe, and we also have Louis joining the team. And this conversation is going to be led by Definite Namo. Over to you, Definite.
Thank you so much, Patricia, and good morning, good afternoon, everyone.
So we've heard a lot around HIV prevention options, around the tools that are available and can be used to make informed decisions. I think you will agree with me that this webinar wouldn't be complete without hearing from the young women themselves, so that we understand what they want, what their experiences have been, and what they would like to see happen in the PrEP space. So Patricia has already introduced the panel, and I'm really keen to start this conversation with those really energetic young women that we have today. So we'll have a varied perspectives from Zimbabwe, from Kenya, from South Africa, and from Zambia. And maybe just to kick us off, just under 1 minute, I'll invite each of our panelists just to tell us what keeps them going, what makes them wake up every morning and think about HIV prevention. So in under 30 seconds, we'll do a round robin. So we'll start with Havana. What keeps you going? What makes you wake up in the morning and think about HIV prevention and make a decision that I'll continue working in HIV prevention? So over to you, Havana.
Hi, everyone. Just to confirm that you can all hear me clearly?
Yes, we can hear you, Havana.
All right, awesome. Okay, so when it comes to HIV prevention and what keeps me going, it starts from the very fact that HIV infection rates negatively affects the quality of lives that a lot of young women may be experiencing. And the fact that I could do something to better someone's life out there really wakes me up in the morning, because I'm like, go, go, go. You can change someone's life for the better. And it's not always about you, you know, in your life. You're here for a purpose. And I feel like my purpose is to help everyone live a better life than they did before yesterday.
Amazing. Thank you so much, Havana. Over to you, Louis. Do you want to say hello to everyone on the line and tell us what keeps you going around HIV prevention?
Thank you so much, Steph. Good afternoon, good morning, everyone. So just a clarification, I am from Zambia. I earlier had Patricia introduce me from Zimbabwe. I'm actually from Zambia, youth representative on the MOSAIC project. So for me, what actually keeps me going is my passion for young people. I am a young person, and I have realized that the rate at which the young people are becoming sexually active is very alarming. In the past years, you find that young people will start having sex at the age of 15, but now, I don't know about other countries, but for Zambia, the age has dropped all the way to 10. So for me, it's that passion to be able to educate and give information to my fellow young people for them to be able to, you know, live a healthy life and protect themselves. So that's what keeps me going. Thank you so much. Over to you, Dev.
Wow, thank you so much, Louis. So I'll move on to Kenya. So Marie, merci. Can you say hello to everyone on the line, and what keeps you going around HIV prevention?
Hi guys, how are we all doing? Happy to be here. What keeps me going is the promise that we have, that is life, that is the future, because looking at where we have come from in terms of prevention, there is definitely hope for us young people, because I believe in the 2000s, there was nothing that you would call prevention. There was in no way would you protect your child. Even for the young people, there was no form of prevention or protection for us to make sure that we are not being infected, which is why you even find the most people who are on care are people from that generation, because of a lack of such methods at this point. So what keeps me going is the fact that I know, I am assured that science is not failing me anytime soon. And by the time that 2030 arrives, we will definitely have found a solution for the prevention and even the eradication of HIV.
Thank you so much. Merci. Science will not fail you for sure if we continue soldiering on. So our last panelist is Mpilo Heather from South Africa, from VITS-RHI. Teli, what keeps you going, and do you want to say hello to everyone on the line?
Yes, thank you, Dev. Good evening, everyone. Just like Dev has mentioned my name. So what keeps me going every day is that I want to see more adolescent girls and young women taking charge of their lives by using HIV prevention products and doing whatever it takes for them to break the stigma against HIV. I mean, back in the days, people would not want to talk about HIV because it's a taboo. And these days, I want to see more young women and adolescent girls taking charge in those spaces, talking about the uncomfortable conversations, like, the thought-provoking conversations about HIV prevention. Thank you so much.
Thank you so much, Teli. So talking about taking charge and those thought-provoking discussions, what kind of support do you think you'll need to really feel confident and empowered to make decisions around PrEP options, what PrEP option to use and when to use it? And I'll start with you, Teli, since you talked about taking charge. Let's hear from you.
Okay, thank you so much. I need basic information on all PrEP products available to me. This means that I need to know what each product is, what it will do to my body when I use it, how long it stays effective, and how much protection it will give me against HIV and the side effects that come with using the product. And lastly, I need a product that will suit my lifestyle and not interrupt it. Thank you.
Thank you, Teli. So you need the knowledge on the product and you need something that suits your lifestyle. That's quite amazing. I hope everyone here is hearing this as we provide services for young women. Let's keep this in mind. So Havana, what kind of support do you think you need? And what is it that would make you really confident and empowered to make any decision around PrEP use?
I think when it comes to PrEP use, one of the most important factors that we need to look into is the use of role models and influencers. As much as having information would be amazing for me to be able to use PrEP and to go and confidently request for PrEP options, I think it would be best to have other influential people in the community advocating for the use of PrEP, making sure that you communicating that the information that PrEP use is empowering and it is putting your health first. I think if we had that, that would be amazing. It would be amazing to have people actually advocating and supporting young girls in choosing to take PrEP.
Thank you, Havana. So knowledge is not enough, but you also need to reach out to those influencers because they influence what you do, how you do it in a big way. Really insightful. And over to you, Louis. What's your perspective on this? What is it that you need? What kind of support do you need, and what would really make you confident around selecting a PrEP option?
Thank you so much, Dev. So from my end, I think I would require support from my peers. I would also need support from the healthcare providers and also support from my parents and my partner. So in terms of my peers, the kind of support that I would love to receive from them is whereby if I go to a health facility, I should be able to find my peer and not an elderly person. I had an opportunity to take part on the PrEP preference study here in Zambia, and we got to engage with a lot of young people that are using PrEP. And one of the concerns that came up was the fact that they were not freely able to express themselves due to stigma and a lot of discrimination and, you know, all those barriers that they face when they go to health facilities because they meet people that are older than them. And some of them are people that they know in the community. So that makes young people feel uncomfortable. So it's very important to actually find my peer at the health facility. That way, I am able to express myself, and they are able to give me adequate information, freely give me information, and I'm able to freely talk about my risk, and also them giving me information about the advantages, the side effects, the pros and cons of that method. And then in terms of my partner, you know how sometimes partners can be an ad or a dis-ad in terms of young people accessing HIV services. So I would also love to receive support from my partner in terms of accessing this information concerning HIV prevention. That way I am able to make an informed decision in regards to my health. Thank you so much, and over to you, Jeff.
Thank you so much, Louis. And just to say, there is a little bit of echo from your end, Louis. I don't know, maybe you can fix it. So we heard about peer support, partner support. That's really critical for Louis. Let's go over to Kenya and from Mercy. What is it that you need supporting, and what would really make you confident and empowered to choose a PrEP option, Mercy?
Thank you so much, Dev. And definitely knowledge tops the list, just as my next geners have said. Knowledge, information comes first for anyone. If at all I need to make a decision concerning anything, knowledge, the amount of knowledge I have on this product will determine whether I use the product or not. So I will not say much on it. My next geners have done justice to that. I'll speak about access and also availability of the options. Access, why? Because if at all we are introducing, you're introducing me to this method, where am I going to get it? Can I as the young person be able to get to that place where it is afforded? If it's a facility, how far is it from where I stay? Who is there? Who am I going to find there? Are the healthcare providers that are trained to handle me when I come? Then the aspect of availability of options. Not everything fits everyone, so we need tailored methods for adolescent girls and young women in all their diversities. We are different. So if there's just one method for one person, then how will you know that this one works for me? But if there are options, provide the options to this AGYW for them to make an informed decision on what would work best for them. And also there's the bit of understanding risk for yourself as an AGYW. Help the AGYW understand what is risk for them, or what makes them vulnerable that they need to use PrEP. Most of the times you find that we don't understand what makes us at risk or vulnerable of getting infected. So if we're able to make the AGYWs understand this, then we will be able to help them to make an informed decision and know that when I am doing XYZ, then this one puts me at a risk of getting contracting HIV, thus requiring me to go to take PrEP. Thank you, and over back to you.
Thank you so much, Mercy. You raised really pertinent issues around access, around tailored methods, and the issue that we are diverse. It's not every young woman who's the same. Not every young woman is the same. Our young women are diverse, and they need different things at different times. So let's talk about the real issues. So some of you might be seeing in the chat where people are saying next gen squad. So the young women we are talking to today belong to a group called the Next Generation Squad. And they're saying we are the next generation who take PrEP to that next level. And now we want to talk about the real issues. Let's talk about your experiences around PrEP, accessing PrEP, accessing information around PrEP. Now that you can reflect back, what is it that you liked about how you managed to access either PrEP services or information around PrEP? And what is it that you absolutely detested around, about your experiences? And this will help us think about how to tailor make the services and information packs for your peers in the future. So I will start with, Louis. Talk to us about your experiences, Louis.
Thank you, Dev. I don't know if the echo is gone or it's still there.
You sound great. This is perfect.
Okay, perfect. So when it comes to experiences about accessing PrEP information, one thing that I disliked is the fact that the access point where people get to access PrEP services is the same point as where people get to access ART services. So there's a lot of discrimination, and this hinders a lot of young people from accessing PrEP because most people will think they're actually there to access ART and not PrEP. So you find that most AGYWs are not encouraged to go to healthcare facilities to access PrEP. So if there can be a comprehensive package that can be set up where you get to put SRHR, you get to put ART, HIV prevention, MCH, all in one package, and people can just go there, it would be great, because that way people wouldn't really know what you're going there for, unlike the way it is right now. And then the other thing is there isn't many peers in these health facilities, and most healthcare providers are not really friendly to adolescents. So you find that the spaces are not really adolescent friendly, and there's a lot of trust issues. Adolescents are not really able to open up freely because they're not really sure if their information will be kept confidential. So I think these are some of the dislikes that I noticed when it comes to accessing PrEP services. So if there could probably be a lot of youth-friendly spaces that can be opened up. These days we have dream centers. So if we could have more people going to the dream centers, more dream centers opened up, even in rural areas, because right now dream centers are only operating in urban and peri-urban areas, which means that the young people in rural areas don't really have dream centers there, so they are forced to go to health facilities where there are no peers, and they're just finding elderly people who are probably neighbors or friends with their mothers, so they wouldn't really feel, the confidence to open up and tell them to say, I would like to access HIV prevention services. Thank you so much, and over to you, Dev.
Thank you so much, Louis. You raised issues of stigma, issues of lack of trust. You need youth-friendly services and facilities. I think those are really great points that you're raising, and we hope you'll be able to address all these issues as we continue delivering our PrEP services. Now I'll move on to Havana. What is it that you liked? What is it that you disliked around access to information on PrEP and access to services?
Okay, so I'll start with what I liked about it. I liked how all the information was laid out very clearly on the pros, the cons, the benefits, the rates of efficacy. But what I did not like kind of outweighs these cons, because it determines whether or not I'm going to go back to the service facility to go and access these PrEP methods. So what I did not like was the high level of judgment from the nurses, and we call them the sisters because they are nurses and we hold them in high esteem like that. I did not like how they brought their religious beliefs and their personal beliefs into the workspace, because that hindered their ability to treat me with impartialism, because they need to be able to wear their nurse hats, work, and act completely professional, give me what I need to protect myself from HIV, and treat me like a normal human being, instead of trying to treat me like a daughter, which may not be the best thing, because the number one thing that we want to do here is provide the logically based service available, right? Because we want to make sure that everyone has a sound base of protection, and not to bring in your personal beliefs. Because if I come into the healthcare facility and I ask for these PrEP services, I expect impartialism. I expect you to help me. I don't expect judgment, because I'm not trying to come into a negative space on purpose. I'm coming to a healthcare facility to access something that should be beneficial to my health, and not to put myself on the front lines. Over to you, Dev.
Thank you so much, Havana. So issues to do with judgment, you liked how information was laid out. for you and how it was presented to you, but the issue of judgment remains a barrier right there. Let's hear from Mercy and what has been your experience and what you liked and what you disliked, Mercy.
I'd speak about service delivery. I'll start with what I liked, then I'll say what I didn't like. Service delivery was great. I actually don't have any complaints about that. Our healthcare providers were very understanding, actually very flexible for that matter. You'd say, I'm not available this morning. Could I come at 2 p.m.? And it was okay to reschedule from morning to afternoon. They'd even sacrifice their afternoon hours where they're supposed to be going home, even going for lunch, and just say, okay, you can come in at this time and then you can just be able to see you. And also they'd have time for you to come share your challenges, if at all, like if you faced any side effects while you're using the pills, or I feel like if at all you had any challenge, whatever it is, you are free to just come in. I didn't need an appointment to go see the healthcare provider. But now the problem here is actually not with the facility, it's with the community, and it's related to what Louis spoke about, where all this is the same place, the CCC, and where we're accessing PrEP is in the same place. So people are associating you with the promiscuity. So if, regardless of what you have gone there to get, you are a promiscuous young woman, why are you needing PrEP? So this one brought a lot of stigma. People would judge you, but you know what you have gone for there. You know the reason behind why you are going to the facility. But then to these other people, it doesn't seem that way, and they judge you for that.
Thank you so much, Mercy. So differentiating services where we are offering ART and where we are offering PrEP, those places should be different. And you also appreciated the flexibility of the healthcare providers. So I think what I'm hearing there is providers should be flexible and flexible and flexible. So that's really great. Let's hear from Kelly. Kelly, talk to us about your experiences around PrEP, what you liked, what you did not like. What was that experience for you in the beginning?
Okay, let's talk about access to information about PrEP choices. So, okay, let's break it down. When I'm on my phone, I want information on Google, websites, and social media like Facebook, Twitter, and Instagram. And when I go to the facility, I would like to talk to someone I can relate to, someone who will not lecture me and judge me. And when I leave the facility, I would want to have someone who can still answer any questions I may have, and that can be a chatbot or an actual person. Yeah, that is how I would like to access information about PrEP choices. Thank you.
Thank you so much, Kelly. So you're introducing issues of social media. You want to be on social media, whether it's a chatbot or it's someone you're talking to on social media, it has to be someone who's friendly, who can relate to you. For you, those are the key issues. So thank you so much for that. So really, maybe switching gears a little bit. And now we know that our next gen squad is familiar with PrEP and all the PrEP options that are available. But tell us, what is it that you think, how do you think your peers would want to access information around PrEP, those who are less familiar with PrEP than you are? Or maybe you can go back in time to a point where you were not that familiar with PrEP, or you heard PrEP for the first time. What is it that you think your peers would want to hear, and how they want to hear this? What would really enable them to make informed decisions around PrEP and which PrEP method to take? And I'll start with Kelly. So tell us, what is it that you think your peers would want to hear from South Africa, and how they want to hear it, and what would really enable, what would be that thing that would enable them to make informed decisions that I'm going to be on oral PrEP, or I'm going to be on the PrEP ring, or care PrEP as it becomes available. So over to you, Celi. Celi, you're on mute.
Sorry. Thank you for the question. Firstly, people need to understand that the way things have been done and the way we have been treated is not working. And judging or shaming my peers and I because we are sexually active does not stop us from being sexually active. And refusing to speak to us about important issues like having a consensual sex or pregnancy prevention only pushes us to get answers from other sources or through experiences, which often have negative consequences. It's time to try something different. Maybe sit with us and have actual conversation with us. We will tell you about our dreams, about our plans, and how we need you to support us achieve these. And we will tell you that going to schools and getting an education is just as important as getting SRH services, tools, and information we need to live healthily. People need to understand that we need our parents, guardians, healthcare providers, teachers, religious leaders to support us with these, to support us when we make these SRH choices. We need our healthcare providers not to only know how to switch from being a parent to a professional care worker who will support us in who will support us in getting the most appealing PrEP method available and do referrals when needed, such or STIs or GP services without violating our privacy and confidentiality rights. Thank you.
Wow, really candidly put there by our young women, and thank you so much, Celi. So what I heard there was, it's not business as usual. Let's try new things. Don't push us away. Engage with us. So really time to do things differently. Thank you so much. And let's hear from Louis. What is it that your peers would love to hear? How do they want to hear it? And what would make them feel empowered to make informed choices around PrEP?
Thank you so much, Steph. So one thing that would really help my peers and I to feel empowered and make the right decision about PrEP is give us all the information that is there. When we go there, help us to assess our risk, because there are some young people that don't know that they are at risk of contracting HIV. So first of all, help us assess our risk to getting HIV, and also give us all the information. And let this information be adolescent friendly. So use the language that is adolescent friendly. Don't come to us using all those, scientific or technical terms and all that. Use a language that an adolescent can be able to understand. And also, we should also be considerate about the young people that are differently abled. So if there could be information about PrEP in Braille, that would be really helpful for them, because there's also a stigma around that. People mostly think just because you're differently abled, you probably are not sexually active and you're not at risk of contracting HIV, which is not really the case. So if they could also be considered, that would be really grateful. And then the other thing is, if we could have a feel of these methods. So if you're talking to me about the dapivirine vagina ring, show me the ring. Let me see how it looks like. Let me see if I would be comfortable inserting it in my vagina. If it's the pills, let me see how they look like. Tell me about adherence and everything. Give me every detailed information about these methods that are there, and offer support. Can I come to you when I'm having challenges with these methods? Am I able to open up to you? So there should be also a follow-up system to support the young people, even as they are using these methods, and even as they're trying to access information about these methods. And this information should be there. Most young people are on social media. Let this information be available on social media. Facebook, TikTok. We have a lot of young people that are on these social media platforms. Let this information be available. In schools, let it be available. Let it be integrated into the educational system. Thank you so much. Over to you, Dev.
Wow, very powerful, Louise. So I hear TikTok, and what I'm hearing is let's be trending on TikTok. Let's talk about PrEP, and the next Gen Squad will be trending on TikTok. So I had social media. You said, give us all the information. Do not withhold anything. Break it down to the T for us and make the language user-friendly for us. Make it adolescent-friendly. Don't talk to us in that research jargon that you talk about, but break it down to the T. And don't make decisions on our behalf is what I heard. Show me the product. Don't talk about the product in abstract terms, but show me the product so that I can make a choice whether I would use it or not. Let's move over to Havana. Havana, what would your peers want to hear and how would they want to hear it?
Okay, firstly, I want to say I agree 100% with what Louis was saying, and I would like to use that as a bridge into what my peers were saying. So in the latest youth consultation we had a variety of different young women representing different subgroups, different key populations, and one of those subgroups were young women from differently abled populations. And a lot of them were saying, yes, we would love for all of you to talk to us in inclusive language. We don't want you to use language that may be derogatory or discriminatory. And we would like to have perhaps healthcare facilities having nurses and health practitioners know how to converse in sign language. Because although we have a large community of the deaf in Zimbabwe, we may not have necessarily a large community of healthcare practitioners that are able to converse in sign language, which is quite crucial considering that we need to be all inclusive and we're talking about diversity. If we're talking about diversity, we have to be diverse in the very sense of the word, which means we should include Braille for the blind, and we should include sign language for the deaf. And we should also consider having infrastructure that is inclusive to those that are differently abled. Instead of having structure that's very much linked to someone who has a pair of legs and can walk up a pair of stairs, it might be discouraging if someone walks up and sees that the building is not inclusive to all sorts of different people, because we don't live in a vacuum. The society is full of different people from all walks of life. So we need to take into account that everyone is different, and we have to try and find a way of including those that are differently abled. Another issue I'd like to raise is that although we may have healthcare practitioners, we may need to also have peer educators, because we know for a fact that young people love to talk to people their own age, and they may feel a sense of comfort that they will not feel with someone who may be a little bit older than her, or perhaps even old enough to be her mom or her grandmom, because the generational gap is quite big and the belief structures have changed over generation and generation. So if we have peer educators that have been specifically trained to be able to talk to young women and AGYW, this could be quite crucial, because it breaks the barrier, it builds a bridge, and it allows for generational communication. And generational communication is a wealth of resources that we don't have currently. So yeah, I think that's one of my main points. And the last one that I would like to raise is, okay, we've talked about generational communication, and I want to talk about empathy building. When I talked earlier about the issue of judgment, yes, it may be happening in some facilities, but a lot of the youth from the youth consultation I conducted a few days ago were saying we need to find a way to create courses for healthcare practitioners working with AGYW, because most of them are not used to putting themselves in someone else's shoes. And if we don't have someone who's able to put themselves in someone else's shoe, how are they going to be able to relate to us? How are they going to be able to understand the problems that a 16-year-old might face right now? She's trying to study for her exams. She's trying to make sure she doesn't get infected with HIV. She's trying to maintain healthy relationships. She's trying to get into university. There's so many big things on her mind. And we want to have someone who's able to say, okay, if I was 16 in 2022, what choices would I be making? What decisions would be weighing down on my shoulders? If someone is able to bring those problems down to themselves and wonder, okay, if I'm 16 right now, I have A, B, C, and D weighing down on me, what kind of information would I need? What kind of advice would I need? Not just in terms of health-wise. We need to think about mental health-wise, which is why a lot of the youth were saying we need to have empathy building training for healthcare practitioners so that they are able to put themselves in the shoes of young women. Thank you. Over to you.
Thank you so much, Havana, and that was really a mouthful and a challenge to all of us here. Let's have trained peers who break down those walls. Let's be inclusive. Let's include those who are enabled differently. Let's not just talk about inclusivity without acting on it in real terms. Let's move over to Mercy, and what is it that your peers would want to hear, and how, Mercy?
I'm not sure there is any more left to say, but I think I'll just add on what they've not said that I feel would be important for us to make sure that other young people have information about PrEP. And I think for one that is key is making sure that we have community-led sensitizations, that because not all of us can be able to go to that facility. Not all of us even have a facility within our local, our areas. So what happens to me if I cannot access a facility? Then I won't get information because most of it is at the facility, or it is on a phone that I also don't have. So how do I get this information as the young person who cannot access these other two areas where information is provided to? Means creating avenues where information can go to the community where these young people are. They have areas where they sit around. There is the movie shops, there is the football areas. Just where can you find this young person? Take information to them. Sometimes they refuse to come to you, but you can go to them. Find them where they are. In school, those who are in secondary school, primary school, they have some time that they have for extracurriculums. Go to that school, ask for permission, teach them 1, 2, 3 things about PrEP, and you have saved the next generation. All those who are in the community, you can go to a church after they have had their service, have a sit down with them for some few minutes, and you have shared knowledge and they have some information. And how does this information look like? Is it simple for them to understand? Not those jargons, as Luyo was saying. There's some words that are used and you're like, okay, what is this? And the person who is delivering this information, they're probably not aware that you didn't get it. So they're continuing with the training or the capacity building session, and you have gotten zero information out of it. So the information should be simple to understand and package it in a way that is fun for them to get it, but maintaining the message there. And also we look at how about you tell me what PrEP can and what PrEP can't do? Because PrEP also will not do everything. It is not going to prevent you from getting pregnant. It is not going to prevent you from getting an STI. Have this information clearly understood by the young person right before you let them leave. If they had come for you either for a session or if you are just passing around information, make sure that this is understood, because people come with myths and stories around and they're like, okay, where did you get this one? So if you're able to communicate this clearly, then there are some of the things that we will work around. And also there's the issue of myths and misconceptions, because definitely there are very many avenues where you can get information and not all of them can be trusted. So how are you able to account that what this young person has is correct, is the correct information? Yeah, maybe provide them with trusted sources of getting this information. Maybe provide a hotline or like a website where they can get, you're sure that they're going to get accurate information if you're not able to provide it at the same at that point. Or even provide them with a pamphlet where they can get and they can answer their questions if at all they have any, or even provide a contact for the facility where if you didn't get anything, you can call this number to get clarifications. And lastly, I'll speak about capacity building of the healthcare providers, which Havana has talked about. This is very important because every day there are new guidelines, every day there is a new method, every day something has been added to make sure that young people receive the utmost healthcare service available. So we make sure that we are also updating our healthcare providers. Sometimes we blame them for lack of knowledge, and it is either our fault or the ministry's fault, whoever else we want to blame, but all of us are to blame because we are not the ones who are updating this. If we have new guidelines, let us have them on board, capacity build them on, like for now we're having a session on this. Let us have the healthcare providers in a room, tell them that we had a consultation with young people and they said that they want XYZ changed. How can we do this? Formulate strategies on how this can be done. It will not happen overnight, but it will take time to do it, but it will happen eventually. We have to engage every partner in this journey, including parents and the religious leaders also. Let us not leave them behind, because they are also key stakeholders in ensuring that the young people are able to use freely the PrEP methods available, because our cultures and religion also play a role in what methods and how I prevent myself as a young person and how I behave as a young person. And I'd like to stop there. Thank you. Back to you, Definite.
Thank you so much, Mercy. I think that was really a mouthful and I can't even begin to summarize it, but simplicity is the name of the game. So I would really want to thank you all. Thank you to my lovely panelists. They're full of energy. We could have gone on and on and on because they have so much to share with us. But really, thank you so much for just coming here and sharing with us. And I would want you to do one more thing. Just put in your parting shots in the chat, because now we've run out of time. So your parting shots in the chat for each of my panelists, and really thank you so much. And I'll pass it back to you, Patricia. Thank you.
Oh, thank you very, very much. This was really exciting, quite a lot of insightful comments and feedback from the panelists. We could have continued doing this for the next other 30 minutes. But as we always know, we run out of time when we discuss interesting things. And really appreciate the team that is here. You are very informed, you know, very empowered, and the next Gen Squad, you are the people to watch. So we are really excited to have you in MOSAIC, and we know you're going far with this. So just for the people who have participated, thank you so much for availing yourselves. We have other PrEP learning networks that are coming up, forums in August and another one in November. Look out for us on the PrEP Watch page, and you can be able to register for the other upcoming webinars. So thank you for the questions that came up, the comments in the chat. We'll be able to compile all this and avail the recording for this particular call, and we look forward to seeing you again. Keep watching out for updates from MOSAIC. Thank you very much, everyone.
Thank you so much.